All right, guys, this is going to be our video about nerve glides. Super important. If you've never had an issue with nerve entrapment down your arm, let me tell you, it stinks. It makes taking a squirt bottle to get the cats when they're being bad. It hurts to squeeze the bottle. Hurts to squeeze the bottle to water my plants that I care about. Hurts to tie my shoes. Hurts to play baseball, basketball, do my exercises. For any patient, orthopedic through neuro, these nerve glides are a super fast, easy way to mitigate some symptoms, improve function, and feel better with little effort, honestly. And as a therapist, once you teach them how to do it, this is completely active, at least what I'm showing you, so you don't have to do anything after that. So it's pretty awesome. So the first nerve glide I want to show you is the ulnar nerve glide. You're going to take your index finger and thumb, bring it together, and you're trying to get it, I'll show you on this side, literally flipped up and on there like that. I just can't even try to do that. I was obviously struggling to do that. And I could feel all that sensation through the fourth and fifth digits here. So, but you're going to have the patient try to do that and then relax. Do that and then relax. And if they need to do this, then they're going to feel a little sensation change in those fingers or down the ulnar side of the arm, depending on where it's entrapped. But there should not be any pain, or really, I wouldn't even say the word discomfort, just a small change in the sensation. And then when it's all done, they should feel better. If they don't feel better, then they either did it too intense or too many times. And then we need to modify those parameters. So that's your ulnar nerve glide. Next is median, elbow extended, wrist extended, head that way and back. Now, you can do a stretch here. You can do a stretch to all of them. I don't recommend it. If you think about this, now I'm going this way, I'm just pulling that nerve apart. Don't really have a need to do that unless the PT says that that needs to be done. Otherwise, I'm doing glides or flossing the whole time. So again, median nerve, that is the floss or the glide, however you want to call that. And then the last one is the radial nerve. I've seen this done multiple ways. For me, thumb in the fingers like this is the easiest. And then when I tilt my head to that affected side, I'm going to ulnar deviate. So I'm going to be in the not anatomical position here. So my palm is facing backwards. And then I'm going to deviate and back. You can extend the shoulder a little bit too, if that makes it a little more intense to kind of get that. But that's how that works right there. And for the radial nerve, I'm going to feel that. For me, I've felt it in the thumb. I've also felt it in the back of my hand when I was having some serious issues here. And that radial nerve glide really helped reduce that significantly. So now I just have some of my thumb, and mostly because I haven't been doing the glides for a couple months. Guess what? Because I felt better, so I stopped. So you got to keep doing it. I love when patients are like, how long do I do this? I'm like, well, if you go to the dentist and he says your teeth are good, do you just stop brushing your teeth? No. But I need to take some of my own medicine. So you, for your assignment, are going to be teaching patients at home how to do these glides. You're going to teach them all three in the same video. And not only do I want to make sure that you're doing them correctly, but I want you to make sure that you're giving them the correct parameters, and correct parameters are whatever you feel is necessary. Say 3 sets of 10, 3 times a day. That's fine. The key is how do you modify those parameters? If, like I said, their symptoms don't feel better immediately after, then maybe they did it too intense or too many, so you just back that down a little bit. I'd rather do a lot of sets throughout the day than a bunch at once and see how that goes. But that's just my preference. You can do it differently. Just have justification and rationale for your parameters and be willing to modify those. If you have any questions about how to do some tech stuff with this, ask me. I have this assignment up until, 12:30, so you have plenty of time to get this done because I understand setting it up, being a director. I'm not worried about this being perfect. Do a couple takes if you want to, and then call it a day. And just submit that or upload that video file to Canvas. And like I said, if you're having tech issues, let me know. We'll get that figured out. So I'm really excited to watch your videos. And honestly, I think starting to think this way about how you can teach physical therapy through this type of platform is going to be beneficial in the future for 2 reasons. I think this platform is underutilized for physical therapy. And number 2, if you're not paying attention, obviously, to the real world, this is where a lot of things are going to go for multiple reasons. For safety and because patients, why do I want to drive the clinic all the time? Just show me the exercise. You imagine if you paid a $25 copay for me to show you those 3 exercises? And let's be serious, $50 copay, $75 copay. when I could just do it online like this. Pretty easy. So good luck with your video. Look forward to seeing it, and let me know if you need any help.